Common questions about falls prevention in elderly. Why are falls in elderly persons important? Falls are the leading cause of fatal and non-fatal injuries in persons older than 65 years. The risk of falls and resulting serious injury increases with age. Injuries, such as hip fracture, and falls are risk factors for placement in a nursing home, where the fall risk is nearly 3 times that of persons living in the community. A history of falls is associated with a 2 to 6-fold increased risk of a future fall. Falls are preventable, and identifications of risk factors are an opportunity for physicians to intervene. What are the risk factors for falls? There are many risk factors for falls, some of which are modifiable. The strongest modifiable risk factors are balance impairment, gait impairment, muscle weakness, and medication use. Fear of falling can result in a downward cascade of events leading to social isolation and loss of function, as well as more falls. Approximately 60% of falls are the result of multiple factors. Potentially modifiable risk factors include cardiac causes like cardiac arrhythmias, congestive heart failure, hypertension. Environmental hazards. Medication use. Metabolic causes like diabetes mellitus, low body mass index, vitamin D deficiency. Musculoskeletal causes like balance impairment, foot problems, gait impairment, impaired activities of daily living, limited activity, lower extremity muscle weakness, musculoskeletal pain, use of an assistive device. Neurologic causes like delirium, dizziness or vertigo, Parkinson disease and other movement disorders, peripheral neuropathy. Psychological causes like depression, fear of falling. Sensory impairment causes like auditory impairment, multifocal lens, visual impairment. And other causes like acute illness, anemia, cancer, inappropriate footwear, nocturia, obstructive sleep apnea, postural hypertension, urinary incontinence. Non-modifiable risk factors include age older than 80 years, arthritis, cognitive impairment, female sex, history of cerebrovascular accident, history of falling, history of fractures, recently discharged from the hospital. What medications are associated with falls? The 3 main groups of medications are drugs are used to treat hypertension, drugs that are used to treat diabetes, and drugs that affect the brain. In the last group, the examples are opioids, antidepressants, anticonvulsants, antipsychotics, benzodiazepines, sedatives, and hypnotics. How do we identify and risk stratify those who are at risk for falls? All persons older than 65 years should be asked annually about whether they have fallen, the number of falls they have had and if they caused injury, and whether they have difficulty with walking or balance. A gait, strength, and balance evaluation should be performed if a patient answers positively to any of the screening questions. The timed up and go, or tug test, 30-second chair stand test, and 4-stage balance test are quick and easy to administer. The tug test is recommended as the primary measure of functional assessment. It involves timing the patient as he or she rises from a chair with arm rests, walks 10 feet, turns, walks back to the chair, and sits. High-risk persons are those who require 12 or more seconds to complete the tug test and report 2 or more falls or 1 fall-related injury. Low to moderate risk persons are those who do not satisfy the high-risk criteria. A multifactorial fall risk assessment should be performed for all high-risk persons. The assessment should include circumstances and frequency of falls, associated symptoms, injuries, medications, other relevant acute or chronic medical problems, activities of daily living and use of assistive devices, and fear of falling. The physical examination should include evaluation of muscle strength, cognitive examination, cardiovascular examination including postural hypertension, assessment of visual acuity, and examination of the feet and footwear. An environmental assessment, including home safety, is also recommended. What interventions are available to reduce the risk of falls? There are two types of interventions: single and multifactorial interventions. Low to moderate risk patients should receive single interventions, which usually comprise of vitamin D supplementation and exercise therapy. High-risk patients should receive a multifactorial intervention, including an exercise program with muscle strengthening and gait and balance training, vitamin D supplementation with or without calcium, management of medications, home environment modification, and management of postural hypertension, vision problems, foot and footwear problems, and cardiac interventions. Interventions: exercise or physical therapy. Exercise or physical therapy alone has moderate net benefit in preventing falls. All older adults who are at risk of falling should be offered physical therapy or an exercise program incorporating balance, gait, and strength training. Vitamin D guidelines recommends vitamin D supplementation of at least 1000 IU per day in older adults at increased fall risk. Medication review. Patients and caregivers must be educated about increased fall risk with polypharmacy and certain medications. When possible, physicians should limit high-risk medications and the total number of medications used. Any medication that was initiated or increased shortly before a fall should be considered a possible cause. Home safety. The physician should monitor progress toward improving home safety, which may be done with the assistance of a home health agency. Training patients about proper use of assistive devices for mobility is an important part of improving safety. Home safety modification interventions reduce falls and are most effective in patients who have a high risk of falls or who have severe visual impairment and when delivered by an occupational therapist. Vision correction. Falls are reduced when regular wearers of multifocal glasses who routinely participate in outdoor activities are given single-lens glasses. Patients who use multifocal glasses may benefit from wearing single-lens glasses for activities such as walking or climbing stairs. The risk of injurious falls increases after a first eye cataract surgery. Second eye cataract surgery decreases fall risk, although fall risk remains above baseline. Delays in second eye cataract surgery should be minimized. Foot care. Podiatry intervention involving routine podiatry care, home-based foot and ankle exercises, foot orthoses, and advice about footwear reduces the fall rate in community-dwelling older adults with disabling foot pain. Older persons should be advised that walking in shoes with low heels and a high surface contact area may reduce the risk of falls. Pacemakers. Carotid sinus hypersensitivity should be considered when a patient has unexplained recurrent falls. Pacemakers reduce falls and syncope in patients with this syndrome.
Audio Jungle. Audio Jungle.